I had a patient who had come into my office who had injured their low back at work. I put him into a BioBack, sent him back to work, came back a few days later, told me they loved it. However, they thought they could accomplish the same thing with any cheap, lesser product they could find at a local drugstore. I advised them there was a difference in quality and how effective it's going to be. They told me that they thought they could take care of it. They went, they got the softer brace at the drugstore, came to me, I fitted them with it, they left for work. 4 hours later, they're back in my office saying, I've got to have the BioBack, this one doesn't hold a candle.
Everyone knows that the skeleton is the frame of the human body, and the spine is the center of that frame. The lumbar spine, or the low back, is the area in which the upper body weight all pivots. This area of the spine happens to be the weakest area of the back, and it also has to carry the majority of the weight and stresses of the upper body. The main thing that makes the BioBack different from any other type of back brace is that it has opposing forces. This opposing force technology is unique in the fact that it puts pressure both on the abdominal area of the patient as well as the lumbar area of the patient, which creates a bridge or a horizontal pressure. The BioBack also has the lumbar dome, which goes against the lumbar spine. It puts pressure on the spinous processes of the spine, which are these points that you see in the back, primarily the lower three spinous processes, causing almost immediate posture correction as well as immediate pain relief. Our treatments last longer when the BioBack is used as a supportive care.
I write at my desk in my house on weekends, and without the BioBack, I'm assuming just a horrendous posture, and I begin to sense pain. And I put the BioBack on, and I can sit there for long periods of time without pain.
I found when I wore the BioBack, I would come home and I would feel a lot more comfortable. I would be ready to go out, I could do rounds.
And one of the things that women experience, and I know for it personally after having had a baby, there is a lot of back strain that you suffer during the pregnancy and during the delivery. And now you have the new situation of not only having suffered this back strain, but having to do things with your back that you previously did not have to do, lifting up babies, equipment, and consequently they do have a lot of serious back pain. This, I think, would be perfect.
It's so safe to use, it's not expensive, and as a few of my colleagues have attested to, their patients have done extremely well, so we know it's an efficacious modality of treatment for an acute back problem.
Certainly, I'm not a proponent of using medications for every ache and pain, and if I can prevent or control someone's discomfort by any other means beside drugs, I would certainly use it. And I have found one way of using it. This is by using the BioBack.
I wear my BioBack during surgery underneath my sterile operating room gown, in which cases I rarely, if ever, feel any pain during the case or after. I've recommended the BioBack to numerous colleagues, many of whom are surgeons as well, and wear it with equal success.
The problem that I found previously with the elastic type of support is that the amount of compression produced from front to back was not sufficient in order to stabilize the back. So I tried this out in my practice. I work in industry as well, and I found that with people with chronic back problems, it seemed to relieve pain almost instantly in most cases. I found myself as a chiropractor in the kind of work that I do, bending over patients and so on. I found that the kind of chronic pain that I was getting was relieved as well.
A lot of the operating room staff tried them on, and at a point it became difficult because everybody wanted one, and there weren't enough prototypes to go around.
Most of my patients are elderly, Medicare patients. High percentage, of course, have back problems, and we've been used to the regular spandex and the Velcro. They're not terribly effective. They lasted maybe 3 months. And when I was introduced to this, I said, this is a good idea.
It would be something that I would recommend to anyone in the field of physical medicine and rehabilitation, and their wheelchair patients would feel much better at the end of the day.
We've all sort of shared our experiences with this product, and I think also that we have realized from talking to each other the vast potential that this product has.